getting answers for Western Massachusetts. This is Western Mass News.
Tracking some weekend winter weather. Good evening, everyone. Welcome to Western Mass News at 6 on this Friday. I'm Chris Pisano.
And I'm Jordyn Jaglinzer for the very latest on what we can expect as we inch closer to the weekend. Let's turn things over to First Warning Meteorologist Janna Brown. Hey, Janna.
Hey, guys. Well, last week, if you remember, some of the storms kind of fizzled out, or this past week. We were going to have one today, but then it fell apart. Well, next week is looking busy. It starts off with a very minor system on Sunday morning where we have a couple of snow showers, maybe a coating out there on the ground. Then we get into the meteor storms Tuesday and Thursday into Friday, where we're expecting snow, possible ice, even rain by the end of the week. So a little bit of everything is going to be on tap for next week. As far as current conditions, though, it is cold and calm, and that's how we're going to start the weekend. Many are in the lower 20s, but quite a few are already in the teens throughout the hills. And it's just been a cold day overall. We only made it into the lower 20s this afternoon. Radar has been showing some of these scattered, very light snow showers, but I have a feeling a lot of them not reaching the ground because the air is quite dry. But you might have just a few flurries around. Other than that, mostly cloudy, temperatures dropping back into the upper single digits to lower teens with a much lighter breeze compared to what we had last night. And if you're heading out the door for your Saturday, just bundle up. It's going to be another cold day. Middle to upper 20s expected, mostly cloudy, and any of the wet or wintry weather we're expecting is not expected to arrive until later. So getting maybe past 11 p.m. all the way out through sunrise on Sunday morning. Now next week, for the kiddos that are still traveling to school, you definitely got to keep an eye on some of these storms. I'm thinking Tuesday we could have some moderate to high chances for school delays or cancellations. We'll take a close look at that weather in just a few minutes. Back to you.
All right, Janna, sounds good. Thanks. Concerns that veterans in Massachusetts are not being treated equally when it comes to getting the COVID-19 vaccine.
A local veteran service officer is sounding the alarm, saying vets in Boston have far better access than those here in Western Mass. He spoke exclusively to Western Mass News reporter Audrey Russo, and she joins us now live with more. Audrey?
This veteran service officer says his biggest concern is what he calls the lack of equality when it comes to veterans able to get the vaccine in Western Mass versus Eastern Mass. If you're a veteran served by the VA Boston healthcare system, your Facebook feed probably looks like this. Regular posts offering walk-in clinics for the COVID-19 vaccine. No appointments needed and offered at different locations. The system even boasts vaccinating seniors ahead of schedule, offering shots to those 65 and even as young as 55. For those served by the VA's Central Western Mass system, Western Mass News has found it's a different story. As of this week, no vaccines are being offered to veterans under the age of 75, and they must wait for a call from the VA healthcare providers to schedule an appointment.
We're being told as much information as them, which is nothing.
The veteran service officer for Ludlow, Eric Segundo, says he's at a loss for what to tell local veterans who call him for help with their concerns and frustrations. You're not upset that veterans under the age of 75 are able to get the vaccine in Boston, correct?
No, not at all. That's a great opportunity for any veteran who can get the shot.
He says he's upset over the lack of access across the whole state.
Why are the veterans of Western Mass have to wait to get a phone call to be scheduled for an appointment?
Richard Askew is a Navy veteran from Ludlow. He says he received a call through the Central Western VA asking if he wanted to be put on a waiting list.
I told them definitely put me on the list, and they haven't called me since.
At 71, his only option now would be to travel to the Boston area or wait until the state opens up vaccine eligibility to those in his age range.
Boston's a long way to go. Can't we go somewhere in Western Mass?
The same services that are being provided on one side of the state should be equally provided in our side of the state.
Western Mass News reached out to the Central Western VA healthcare system, and a spokesperson says in part, quote, "We are vaccinating veterans to the capacity of our inventory and going to their homes when needed. Veterans may receive the vaccine at any VA location where it is available." But for those who can't travel, Western Mass News brought these concerns to Ryan Lilly, the director of VA New England Healthcare System. Lily claims the Pfizer vaccine is being given out at Bedford and West Haven, Connecticut, because they can accommodate the ultra-cold temperatures that shot requires. He says the Moderna vaccine is being given out at multiple VA locations across the state, including Western Mass. And he says the New England VA system is given roughly the same amount of each vaccine.
If you're spreading the Pfizer vaccine across 2 sites and the Moderna vaccine across 6 sites, well, the Moderna sites are getting fewer individual doses each week, and Central Western Mass happens to be one of the Moderna sites.
However, Lilly claims the allotments are being shifted to afford Western and Central Mass more doses.
Somewhere around a 3-fold increase in what they've historically been getting per week compared to what they got this week and what they're getting next week.
Lilly says Western and Central Mass vets will have walk-in clinics by mid-March and a number to contact for help rather than waiting for their own phone to ring.
By next week, we'll be publishing a phone number that folks can call.
Until then, veterans who've been waiting to return to normalcy are doing what they can to avoid the deadly COVID-19.
I do want to get the shot. I want to stay safe as possible.
Now, Ryan Lilly says that he's planning for the week after next for there to be a vaccine clinic in Western Mass, and he says he's hoping that the West Haven, Connecticut location will be able to bring some of their doses up to the Western Mass area in order to vaccinate more veterans. Live in Springfield, Audrey Russo for Western Mass News.
Audrey, thanks for that live report. Turning now to the latest coronavirus numbers in our state over the past 2 weeks. The Massachusetts Department of Public Health is reporting over 2,000 new cases of COVID-19 today. That brings the total number of confirmed cases here in the Bay State to more than 525,000. Over 48,000 of those are believed to currently be active. The state is also sadly seeing 87 new deaths. The statewide death toll is now just over 15,000.
New guidance tonight from the Centers for Disease Control, a roadmap for getting students in kindergarten all the way through high school back to in-person classes.
It's based on community risk levels. Western Mass News reporter Leon Purvis joins us live from our downtown studios with more. Leon?
Jordyn, Chris, the way the CDC breaks down their risk levels is in 4 different colors, very similar to what Massachusetts already does. Now, here is the chart on your screen right there. In the blue and yellow, which is low to moderate transmission, the CDC says students K through 12 can be in school learning in person with face coverings and staying 6 feet apart. And sports can move forward in these 2 categories as well. Now, when it gets to the orange level, representing substantial transmission risk, the CDC says all grade levels should go to a hybrid learning model, and sports can only be held outside. Now, when it gets to the high risk level of red, the recommendation is virtual classes for middle and high schools, and that goes for sports too. Western Mass News reached out to the mayor of East Hampton for her reaction to these new guidelines, as her students in her community will begin returning to in-person classes on February 22nd.
Younger students, when properly using mitigation strategies, masking and distance, don't transmit as much an infection of COVID-19. And with this affirmation from the CDC, I think it also goes to another very important element of all this, which is public confidence.
Now, another thing to note, schools are not required to reopen under this guidance. Also, the CDC does not suggest that teachers and staff have to get the COVID-19 vaccine before returning to in-person classes. Now, also, masks, social distancing, and hand washing are still in play to ensure a safe learning environment. Live in Springfield, Leon Purvis, Western Mass News.